Hello, my name is Molly Sullivan, and today I'll be talking about the essence of humanity, which is the sanctity of human life. Physician-assisted suicide, or PAS, as I'll discuss in this more in this discussion, should not be legalized in America due to the moral, ethical, and emotional negative implications it will have on healthcare system and health disparities in America. The Hippocratic Oath that is followed by all healthcare professionals and physicians states that I will keep the sick from harm and I will neither give a deadly drug to anyone who asks for it. This quote alone highlights that PSA violates and goes against the fundamentals of how we practice medicine in America and should not be legalized. The three topics we'll be discussing today are the imbalance of patient and physician power, the marginalized groups, such as women and elderly, and those of lower socioeconomic status, and the likelihood of attempting to extend beyond the original intent. Physician-assisted suicide should not be legalized in America. So, PAS can be defined as physicians giving life-ending medication to a patient to administer themselves to end their life. If a patient is unable to administer this medication on their own, a physician is able to administer it. However, this is called euthanasia, and these two terms are not interchangeable and should be distinct from one another when discussing PAS and euthanasia. Countries such as Belgium, Netherlands, and Germany have started to adopt PAS in their healthcare system. However, through quantitative studies that we'll be discussing, down in Belgium, we can see the negative implications it has already had on communities, and we'll be discussing that more over. So the first topic we'll be discussing today is the power imbalance between patient and physician. So when a patient goes into a physician's office, the expectation is the physician has their health and their needs prioritized. And because a physician has more knowledge and information compared to the patient, if a physician is offering treatment such as physician-assisted suicide to the patient, it breaks the trust between the two, especially when a patient cannot fully consent to life-ending treatment due to not being in the correct state of mind due to mental illness or a chronic disease. And when talking about an imbalance of power, health literacy is an important topic to discuss, especially when 12% of Americans are sufficient in understanding their diagnoses, recognizing warning signs in their health, and to communicate efficiently with their healthcare providers. Only 12% of Americans are able to do that to better their quality of life. So physicians should not have the responsibility to give patients that ability to end their life, especially when the Hippocratic Oath states that they should be having their health in mind, especially when practicing medicine is not separate from emotion. Even though medicine is very technical, healing and compassion to help others is one of the biggest reasons medicine has come as far as it has today. And so legalizing PSA will corrupt the trust between the healthcare provider and the patient. Now going on to the marginalized groups that are most likely to be affected by PAS. A study done in Belgium between the years 2007 and 2013 showed more than a 30% increase in physicians offering PAS to women, elderly, and those of lower educational and socioeconomic status. And this is very important to understand and to acknowledge because these groups are all marginalized groups, which means they are more likely to be vulnerable to coercion due to poor health literacy, implicit bias, and lack of advocacy and support. The health disparities in America are already wide and should not be furthered by legalizing PAS. Furthermore, the convenience and to expand the intent of PSA is a large contributor of those against PAS, and this has to, and this more states goes against the caregivers and those with medical power of attorney of those, and it helps them to alleviate the responsibilities of taking care of individuals, especially when we live in a time where people are living well past good quality of life years, I would say. And a study done between 2001 and 2017 has shown an increase in about 20% among new nursing home administrations or nursing home buildings, and an increase in nursing home admissions. And this is very important to understand because this is one of the major demographics of PAS. So there's a positive correlation between the nursing homes and the number of legal PSAs that would happen. And just because something is legal does not make it ethical. We can see this in American history when discussing slavery. Slavery was legal in the United States up until the 1900s, where the government started to combat the immorality of slavery. So just because something is legal now does not make it ethical. Now, the opposing argument in favor of physician-assisted suicide is giving the autonomy to those for a with dignity. Sorry. And I believe this discussion is weak due to the defining definition of autonomy. So in the United States, debating the word autonomy has very different meanings based on the topic. So each topic of autonomy, whether it be women's right to their reproductive health or the autonomy of ending the end of life decision, have both different results, which the argument for legalizing physician-assisted suicide falls short because the inconsistency in defining what autonomy is from an ethical and legal standpoint. So physicians should not have the responsibility to assist or euthanize human lives. Medicine has come a long ways, and we are now able to give honorable death to those with terminally ills, and it is more ethical to withhold life-saving medication rather than administering deadly drugs to those who wish to die. To glorify a dignified death is detrimental to the obligations physicians have to their patients. So thank you very much.